I like to invite every self-healer to this channel. Today we're talking about depression, and I will give you a virtual counseling experience so that you get to understand what is happening in therapy room. So stay tuned. Today we're talking about depression. Depression is very common in modern society, and we're having a conversation here together. And I'll be facilitating this virtual counseling session with you as if we are having a conversation, as if we are exchanging ideas here. So that you get an experience, what it's like to be in a therapy room, what it's like to promote this healing process more and more. Here's what we are going to do. I'm going to ask you a set of questions, and I'll give you time, or you can pause the video to think about your answers. Think about your thoughts and feelings. It will be a good idea to have a pen and paper handy and write it down your answers. Or even better, you can talk it out loud so that you can hear yourself. You can understand what is really happening inside. So that's the whole purpose of this virtual counseling session, so that we are interacting, and also you're interacting with yourself and get to know what's really happening deep inside. Just FYI, there's no right or wrong answer here. I want to create this space so that it is space for you to feel safe and comfortable to process what's really happening due to depression. Alright, let's begin. Welcome to my first virtual counseling session. First, I'd like to talk about your goal. Having a goal is important so that you know what is the progress that you can make in terms of the depression that you're experiencing. So I'd like to get to know you more. What brought you here? What do you hope to get out of therapy? Please, I'll give you time here. To help you with therapy goals, I'd like to give you an example. The goals can be decreasing depressive symptoms, decreasing lack of self-esteem, increasing sense of competence around work, enhancing your relationship with your family, being able to socialize with others. I want you to at least come up with 2 goals, and I'll give you time here. Great, you have great goals. How would you feel if you're able to achieve those goals? Are you feeling better about yourself? Or those goals are too unrealistic? If you feel kind of confused about those goals, maybe you want to revise it so that it is realistic for you. I'll give you time here. In order to achieve your goals, I want you to understand that it takes time and effort. If those goals are overnight acquisition, you probably have completed in the past already. So it takes a lot of patience. It takes a lot of understanding about yourself. So let's be patient with yourself. I want you to ask yourself how ready you are when you think about those goals. Maybe you can use a scaling question on a scale of 0 to 10. 10 being the most ready you can be possibly, and 0 is like you're not ready at all. What number would you like to give yourself? Let's think about that. I'll give you time here. Alright, I'd like to get to know you more. So let's talk about who you are as a unique person. In this case, I'd like to talk about your strength. In order to help yourself achieve your goals, it is important to be aware of your strength and have a great understanding of how you can use your strength in order for you to get closer and closer to your goals. So can you tell me what kind of strength that you have, and how can you use that strength to achieve your goals? Let's think about that. I'd like to hear at least 3 strengths that you have. I know, it is hard to think about the good side of you, but let's brag about yourself. That's fine. This is the moment to think about positive side that you have. To help you identify your strength, I'd like to give you some examples. So strength can be being responsible, punctual, friendly, hard worker, creative, approachable, patient, and so on and so forth. So let's think about your strength. It is very important to be aware of those strengths. I also like to get to know your abilities. The abilities mean the things that you enjoy, the things that you're good at. It is important to sharpen your knife around the skills that you already have. So for example, abilities can be your relaxation skill, your social skill, your job skills, your educational skills, or your cooking skill, your athletic skill, and you name it. Do you define what skills that you have and that you can use on a daily basis? Alright, so now you write down your abilities, or you can say out loud. And I'll give you time here. You are aware of your strengths and abilities. Strengths and abilities are kind of tied in together, because abilities you have can help you bolster your strength and vice versa. Let's say you have a great job skills. Job skill can help you become more responsible, more patient, and more competent, and so on and so forth. So let's connecting dots between your abilities and your strength. Before we fix the problem, we have to get to know the problem. We have to analyze the problem. And today we're talking about depression. And I'd like to spend some time to give you some education around depression. What is depression and how depression is impacting our daily life? Depression is very common. 1 out of 6 adults in America experience depression at some point in their lives. But there's a difference between feeling depressed and having a clinical depression. According to DSM-5, Diagnostic and Statistic Manual of Mental Disorders, here are general symptoms of depression. And in order to diagnose someone with depression, one needs to have at least 2 symptoms that last about at least 2 weeks or longer. Here are symptoms of depression, and I'll prepare here, so I'm gonna read it off of it. Feelings of sadness, tearfulness, emptiness or hopelessness, loss of interest or pleasure in normal activities such as hobbies or sports, sleep disturbance including insomnia or sleeping too much, tiredness and lack of energy, so even small task takes extra effort, slow thinking or speaking or body movement, feelings of worthlessness or guilt, fixating on the past failure, frequent or recurring thoughts of death or suicidal thoughts or suicide attempts or suicide, unexplained physical symptoms such as back pain and headache. So if you experience at least 2 symptoms or more lasting at least 2 weeks or longer, that can consider clinical depression. In order to keep track of depressive symptoms, here's the inventory I like to use. It's called Patient Health Questionnaire 9, PHQ-9. I put a link to PHQ-9 in the description box. So, it would be a good idea to fill it out once a week so that you can keep track of your symptoms. Now click the link and take your time to fill it out, and I'll give you time here. So next time when you fill out PHQ-9 again, I want you to compare your score today and your next score, your total score here, so that you can see your progress in terms of symptom management. On a surface level, counseling seems to be just talking and processing whatever is going on. However, I like to make it very visual, measurable outcomes in our counseling session so that we can see what progress you're making, what symptoms has been reduced, what symptom has been increased, so that we can see, we can have targets here and work on those targets. With that said, I'd like to move on to the next thing on our agenda. I'd like to spend some time to talk about your presenting issues. What issues are bothering you? What issues are causing depression? And how is your depression manifest itself in your life? What area are problematic? To help you identify your issues, I'd like to give you an example here again. Examples can be social isolation, poor performance at work, lack of motivation, not having purpose or meaning in your life. So I'll give you time here again. Let's think about your issues and how depression is reinforcing these issues more and more. So let's think about that here. Now you're mindful of these presenting issues, and I'd like to give you a tool that you can use. Monitor what's really happening due to your presenting issues. The tool that I like to present to you is self-monitoring. it is important to monitor how your mood fluctuates day in, day out. Depression is very subjective feelings, and I understand that it is hard to describe how we feel sometimes. And here's a little structure that I like to add to your self-healing process. The structure is the scaling questions. You can simply ask yourself how depressed you are today on a scale of 0 to 10. 0 is you're emotionally stable, 10 being the most depressed. It will be very helpful to journal about this. If you're already journaling about your emotion, this is a question that you can add. And I'm not saying that you need to write long paragraph when you journal. I want you to simply write down how you feel, and on a scale of 0 to 10, you write down the number 4 times a day. The second layer I like to add to your awareness is your physical state. What is going on physically when you feel depressed? Because depression brings a lot of physical sensations. Here are examples of physical sensation associated with depression. Foggy mind, tense neck, feeling drained, lack of energy around upper body, tension around lower body, slow heart rate, slow breathing pattern, poor appetite, feeling drowsy, so on and so forth. So you describe your own physical sensation when you feel depressed. I like to say that when our body is relaxed and stable, our emotional state is also stable and relaxed. So it is important to monitor your body, right? How your body responds to your emotions. And a great tool that you can use is a body scan, like scanning from head to toe to see if there's any tension or relaxation that you notice. For me, my shoulder holds a lot of emotions. Like when I feel energetic, my shoulder gets lifted up. When I feel anxious or angry, my shoulder gets really tense. When I'm feeling relaxed and comfortable, my shoulders kind of drop and also relax. It is hard to describe emotions, so I ask my shoulder to see how I feel. The last layer I like to add to your awareness is your cognitive state, your thinking state. It is important to understand how your thinking process operates and how you organize your thoughts. Instead of looking at only distressing thoughts or worries, here are 3 questions I want you to take home so that you can understand the overall quality of your thoughts. The first question you can ask yourself is what is the pace of your thinking process? How fast is your thinking process moving? How slow is your thinking process moving? Or is your thinking process moving at neutral pace? When my thinking process is moving slow, that means I might be feeling depressed or sad or tired or relaxed or relief. Whereas when my thinking process is moving fast, that means I might be feeling angry, upset, or more motivated, optimistic. So it is very, individualized experience here. The next question you can ask yourself is how your thoughts are placed. In other words, the order of your thoughts. Are your thoughts organized? They're placed in certain places and you can kind of see which thought you can pay attention to? Or your thoughts are kind of scattered everywhere in a disorganized manner. So it's hard to pay attention to one thought to another. So for me, when my thoughts are organized, I'm more focused, I'm feeling happy, I'm feeling relaxed, relief. Whereas when my thoughts are disorganized, sometimes I can feel anxious or depressed, I'm really upset, or I'm having really creative thoughts. That's why I'm jumping to one topic to another. So you describe, how your thoughts are placed and how are you feeling when you notice that order of your thoughts. The next question you can ask yourself is, are you thinking about future? Are you thinking about present? Are you thinking about past? Because sometimes we can dwell on our past. We can dwell on our future. Or we can be in the present moment. We're thinking about what's happening here. Depends on the timeline of your thoughts. We can have different emotions. And we can have different physical sensations. So let's ask yourself, how are you feeling when you're thinking about future? How are you feeling when you're thinking about present moment? How are you feeling when you dwell on your past? Or you can think about your past and present at the same time, or future and past at the same time. So let's see how you feel. Sometimes thinking about future, we can feel hopeful. Thinking about past, we can feel motivated because all the achievement that we made. And on the other hand, when you're thinking about a lot of uncertainty regarding our future, we can feel anxiety inside. So let's connecting dots between the timeline of your thoughts and how are you feeling emotionally and physically. One analogy I like to use in order to help you understand the benefits of self-monitoring is looking at the forest instead of trees. Sometimes we're just paying attention to our emotions. Sometimes we're just paying attention to our physical sensations. Sometimes we're just looking at our distressing thoughts. Why don't we take a step back and observe what's happening physically, emotionally, and cognitively, so that we can get a broader perception on what's happening internally. Scaling question can be a great tool. So I want you to ask yourself simply, how depressed are you on a scale of 0 to 10? Again, depression is a very subjective feeling. So 10 being the most depressed you can be, 0 being you're emotionally stable. Last but not least, here's another scaling question I want you to ask yourself. The question is, how much progress did you make today on a scale of 0 to 10? 4 questions I want you to take home today. The first question is, how depressed are you today on a scale of 0 to 10? The second question is, what's happening physically today? Any tension, any relaxation that you notice by scanning from head to toe? The third question is, what is the quality of your thoughts today? The pace of your thoughts, the order of your thoughts, and the timeline of your thoughts. The last question is, how much progress did you make on a scale of 0 to 10? By asking these 4 questions 3 to 4 times a day, you will get a great understanding of how this physical, emotional, cognitive state fluctuate up and down. We might feel less depressed in the morning, and over time we might feel more depressed at night. Let's monitor throughout the day what is really happening. What time you feel better, what are the things that you're doing that make you feel worse or better. Depression can be very devastating from time to time, and I'm concerned about your safety, because safety is your priority. So if you have a thought of ending your life or hurting others, please reach out to local emergency services or call 911. And down in the description box, there's a national suicide hotline. So if you need someone to talk to, you can also call that number. Before I end our session, I'd like to leave you with this question. What can you offer yourself in order to make progress? This is a question that I like to ponder over and over, because I can only define what progress is. Because you can only see what progress is happening in your life. And others can also see it. But it comes down to your perception. So you define your progress. In our next session, we're gonna review what we talked about today and talk about your progress. And we'll be talking about behavior technique. So stay tuned. I'll see you in my next video, and take care of yourself and do your healing every day.